Okay, this is our home screen. This is basically going to be your home. It's a place where you can actually explore a little bit. But to begin, you'll press the menu button on the left-hand controller. Again, we recommend starting with the tutorial, but you can redo that as many times as you want before going on to the virtual OSCEs. Also, in the menu, you can do some personalization. Go here, change your hands. To move right now in the app, you can see here we're in the VOSCE hall. Using your right thumbstick, press forward, and you'll see this rainbow arc appear. This is a way of teleporting throughout the map. In the next week, you'll be able to move using the left thumbstick, and it'll be what's called continuous movement. We don't recommend continuous movement for people who are very new to VR. It can make you a little sick at first, motion sick, until you get used to it, but this teleportation is the best way to move right now. Right now, to start your VOSCE, you're going to press the start button on this timer here. You now have 8 minutes to complete the checklist on the wall. If you want to reset this timer, stop it, and there you go. To feel a pulse, which is something you do quite regularly, you're going to use the trigger button here. So with your index finger, you're going to grab the controller, and you see if I hold that over the radial pulse area, now I'm taking the radial pulse, and my controller is actually vibrating, so I can feel that this is a regular rhythm with a rate probably around 60. Anytime that you want to grab an object or interact with it, you use your middle finger when you grab it on the controller, and it looks like this on the avatar's hands. And so I can do that with washing my hands. I can do that with the stethoscope. So I can use my stethoscope here, which again, I'm grabbing with my middle finger, and I can place it over the heart regions and hear the heart sounds. Another common interaction that you use on a patient is with palpation. And so palpation is done, again, using the middle finger on your controller, and you'll hold this red dot here that you see in the region you want to palpate, and there you see we're palpating the upper right quadrant, and now upper left quadrant. Now, another way that you can interact with the patient is using speech. And so you can use speech just by talking to them right now. There's a limited number of commands right now that's going to be growing over time. Or you can look on the wall and you can select things from this list, and the patient will do it. For example, I can ask the patient to lean forward, and they're sitting up. If I wanted to do this particular interaction, I'd say to them, window test. And you can see that the patient shows me, and I'm checking the Shamroth's window to see whether they have clubbing or not. Anytime that they're in a position like this, you can say the words, please relax, and they'll relax.